In this hospital, your next visit may be your last.
All visitors, please leave the hospital. Dr. Len wants...
Visiting hours so frightening you may never recover. Starring Lee Grant, William Shatner, Linda Pearl.
Fruitless mortal, you have inadvertently tuned into the forbidden frequency. It's Zombie Astronaut's Frequency of Fear.
I am a great driver. I am a great driver. I'm a great driver.
He's a great driver.
He's a great driver. Yeah, yeah, yeah.
This is Sergeant Staccato with the...
I'm a great driver.
Oh, yeah. He's a great driving mother.
Shut your mouth.
I'm just talking about the zombie astronaut.
Can you dig it?
We come here today to join these two in... We come here today to mourn the loss of this young couple.
Congratulations, Mr. Flugelmeyer, on the full recovery from your breakdown.
Oh, thank you, Doctor. What a relief to know that I won't be seeing any more zombies driving around maniacally in out-of-control Studebakers.
Somebody stop that thing!
Of course, maybe I could stay another week just to be sure.
I think that would be best. Indeed. Do you mind if I join you?
We're ready for launch in T-minus 10 seconds. 9, 8, 7, 6... Aw, heck, would somebody scan the Bad Bird space shuttle back up?
Jeez, Pete.
Ambulance!
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 I'm fine, really.
Ambulance!
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 Really, there's not a lot a hospital could do for me. You see, I'm
Going to the hospital!
Going to the hospital!
Going to the hospital!
Going to the hospital!
Get in the gurney!
Get in the gurney!
Get in the gurney!
Get in the gurney!
Hey, let go of me! Ow! Watch it!
Sorry!
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 Ow! What
Sorry!
Sorry!
Sorry! Sorry!
Would you lobotomize baboons? Let me off this gurney! I don't have to go to the hospital!
Whose remains will be placed here in the earth. Whose remains will be scattered all over this sacred ground.
We're ready for launch again in T-minus 10 seconds. 9, 8, 7, 6... Forget it. Just forget it.
How are they gonna get into space?
Well, they can walk there for all I care.
Run to hospital with Gurney!
Run to hospital!
Run to hospital!
Run to hospital!
Unstrap me! Come on, let me off this gurney!
Calling Mr. Davalina, Mr. Bob Davalina. Mr. Davalina, Mr. Bob Davalina. Come to the receptionist, please.
Wait in the waiting room!
Waiting room's for waiting.
Waiting room's for waiting!
Wait in the waiting room.
Good gravy! What was that all about? Maybe I can sneak out now.
Mister, hey, mister, have a seat. The doctor will be with you shortly.
I really don't need a doctor.
You're in the waiting room of a hospital. You must need a doctor.
Except that I don't, though. Really. I'll just leave now. Oh, hey.
Sit down, mister, and wait for a doctor.
Do you normally pull a shotgun on patients?
It's called tough love, mister.
Wow.
That's enough, Mr. Mew Mew. I'm administering tough love.
Wow.
Would you like to read this?
Sure, why not?
Here you go.
Let's see. Dewey beats Truman. Really? Is there anything current?
That is current.
How long have you been here?
Since I was this many.
I have got to get out of here.
Everyone, my name is Nurse Bosom. We'd like to apologize for the delay, and we'd like to give everyone a complimentary dose of the hot new drug that's sweeping the nation, Upliftazine.
Dr. Howard, Dr. Fine, Dr. Howard, report to consulting, please. Please report to consulting.
What's this Upliftazine?
Being in a bad mood from waiting in the waiting room of a hospital for up to 80 years can be detrimental to your good mood and can affect your job, family, and sewing circle. Your doctor can help by prescribing Upliftazine. Upliftazine can boost your serotonin and endorphin levels to a level that can only be achieved by taking dangerous narcotics. Only Upliftazine is legal. Have your doctor prescribe Upliftazine. Upliftazine should not be taken if you have diabetes, emphysema, acne, or body hair. Upliftazine can cause indigestion, constipation, diarrhea, advanced mutation, spontaneous combustion, or bad moods. Upliftazine should not be taken. Try Upliftazine. The pharmaceutical companies will thank you. Here you are. Here you go, old-timer. Here you go.
This Upliftazine tastes like happiness.
Here's some drugs. Here's some Upliftazine for you, little boy. Here you go.
Now I have 3 arms and lots of smiles.
Here you are, sir. Ma'am, here's your Upliftazine. Here's your dosage. Goodbye. Enjoy your Upliftazine. Hey, who are you?
See ya. There has to be an exit here somewhere.
Now let's see if we can fit my entire fist in there. What?
I assure you, in-office amputations are quite routine these days.
But I came here because of migraines.
And once the head's removed, you won't have them anymore. Trust me, I'm what are those things called? You know, with the white coats and the stethoscopes?
What kind of hospital is this? Fellow astronauts, want to try to figure out how to get the heck out of here? Why don't you listen to a little bit of OTR? I am certainly not the only person to ever have a bad hospital experience. I'm sure many of you out there have had bad hospital experiences too, and this podcast is about bad hospital experiences. In fact, our first OTR example of bad hospital experiences is really bad. Listen to Fear on 4's Routine Operation.
Welcome once more to my twilight world of secret fears. Those fears lying deep in our imagination. Pause to think. If the lighting in your home goes wrong, you're happy to call an electrician. If something goes wrong with your car, you're happy to take it to a garage. After all, that's what those people, those places are for. Yet, when illness comes, there are many of you who dread going to the place especially designed to help you, the hospital. Such a person is Mary, the lady in this story. Mary may have to have an operation. Not pleasant, of course, but why does Mary have a special fear? After all, the operation would be strictly routine, wouldn't it?
Splendid. Gloves. Thank you. Let's begin then. Are you the student?
Yes, sir.
Come round here. You'll only see my backside from where you're standing. Right. Been in the theatre before?
No, sir.
Well, if you're going to faint, do it now or give us good warning. Can't have you falling into the works. This operation is an appendicectomy.
Yes, sir.
Look and learn.
Mary, for God's sake. Mary. I'm going to phone the doctor.
No, you're not. It's not that serious, really. Food poisoning, probably.
Food poisoning? I hardly think so. But even if you're right, you can still see the doctor.
No, thank you, Derek.
So what are you going to do?
What do you mean?
Well, you're going to lie there in bed and let it get worse and worse?
It's not getting worse and worse.
Show me where it hurts.
I've shown you.
Show me again.
Oh. It's here. Don't do that.
I reckon it's appendicitis. I had mine out when I was a kid.
Well, for you.
No, what I mean is that's where the pain was. Let me call the doctor.
No.
Mary, you're being stupid. If it is appendicitis...
It isn't.
But if it is and you don't get it seen...
It isn't appendicitis.
Let me call the doctor.
I said... No.
Now, it happens to be the case that no matter what successes a surgeon achieves inside his patients, as it were, the patients themselves regard operations as absolute failures if they get left with heavy scars. So, first thing, we want to ensure that after we finish, the wound joins up properly. How do we do this?
Blue dye, sir.
Correct. A mark here, where I'm going to make the incision, and then across that mark here, here, and here. Match up the lines when we're stitching. Good.
I am not seeing the doctor. I am not going to hospital. This is my pain. Leave it alone. Oh, please, God, let it be food poisoning. Derek? Derek?
Yeah?
What's the time?
9 o'clock.
Well, aren't you going to work?
No, I'm looking after you.
I don't need looking after.
Also, I'm waiting.
Waiting what for?
I've been on the phone. Doctor's coming round as soon as he can. I'm sorry I had to, Mary.
No, you didn't. I told you.
Yes. I'm sorry.
I refuse to see him. I mean it.
Mary, now that is stupid. I'm not being fair.
Fair? Don't you talk about being fair.
I meant on yourself.
No, you didn't. Look, I do not want to see the doctor. I refuse to see him. Now, why can't you accept that?
Because I love you.
Oh, don't give me all that crap. If you had any kind of affectionate feeling for me, you would respect my wishes. You wouldn't cheat on me. Damn you!
Mary, why won't you see the doctor? Why, what is it you're so frightened of? Tell me.
It's very simple. If I see him, he'll quite possibly say that I have to go to hospital.
Ah, so you admit... right, okay. I understand. When was the last time you went to hospital? I mean, you've never been ill all the time you've been married, not seriously ill.
No.
Well, what about before?
I've never had to stay in one. I've been there just for little things and to visit.
But nonetheless, hospitals scare you.
Yes, they always have. And they scare me 100 times more so right now.
Well, that'll be, well, I mean...
It's not appendicitis. You won't have to go to hospital. Must be calm. Second song to myself. One green bottle hanging on the wall. One green bottle hanging on the wall. No. You start with 10 or 12. God, you bastard, Derek. 12, 10 green bottles hanging on the wall.
Darling.
Darling, is it?
Dr. Pearson's here.
Hello.
Hello. I think I have appendicitis.
Sometimes, Mr. Russell, appendicitis doesn't require immediate action, but I'm fairly certain that your wife has it in an acute form. Important that you get her to hospital straight away.
Right.
Can you take her in yourself?
Well, I can, if she'll let me.
Ah. Hospital phobia, eh?
Yeah, I know she seemed very fairly calm.
But it might be hard work getting her out of the house. I understand. Here we are. One for now, without liquid if possible. Others as backup, just in case she's not admitted when you take her. But I think she almost certainly will be.
Thank you.
Hope all goes well. There's no need to worry, though. Routine operation.
Tools of the trade. Scissors, dissecting forceps, tissue forceps, knife. Scissors held thus, so when not in use can be left to hang on the ring finger, while the other fingers do their work. For forceps, thumb and first finger. Knife thus. Is that all clear?
Yes, sir.
Right, let us commence. The incision. Firm, but gentle.
Mary, please.
I thought I was brilliant with the doctor, didn't you? How marvellously meek and submissive I become when confronted by a medical practitioner.
Mary, you have acute appendicitis. You should be in the hospital by now.
I'm not going to hospital.
Why?
Because I'm frightened.
Why? Why are you frightened?
I don't know. Everybody's frightened of hospitals.
Mary, look. The doctor gave me these pills. Don't be relaxed.
No, thanks.
Please take them.
They won't send me to sleep.
No, just calm me down, that's all.
All three? No.
Yes.
All right. But I am not going to hospital.
There. Incision complete. Thank you, nurse. 3 inches, by the way, should be quite sufficient.
Yes, sir.
Now, the next step is to catch the edges of the aponeurosis and retract them. True or false?
Oh, true, sir.
After that, we'll separate the fibres and retract them, divide the peritoneum and lift it. You still chipper?
Oh, absolutely, sir. I'm fine, sir, fine.
It's time. Come on, we've got to go. Mary.
No.
What is it that really frightens you? The operation?
Yes, I think so.
Right. So what you're worried about is the risk, the slight risk.
It's not a slight risk.
But, Mary, it is. A routine operation.
No, you don't understand it. It's not that, not really.
Well, then what? Surgeons? Nurses? Knives? Needles?
Yes.
White coats?
Green gowns.
The smell, the whole caboodle?
Yes. No.
Tell me.
There's this... I've been having a dream.
Oh, come on.
Oh, well, you take that attitude.
No, I'm sorry. Let's hear it.
It's the same dream. It seems to me that the last 3 nights... It's like a memory of something. A very muddled memory, and yet very real. But it's something that hasn't happened. Or not yet. A warning, perhaps.
And the dream takes place in a hospital?
Yes. The operating theatre in the main. I can picture it so clearly. Picture it, hear it, feel it. The tops of the faces, the green of the gowns, the soft, metallic clanging of the surgical instruments on the trolley, that deep red. Quiet conversation. The cold. Each night, and every night the same. Don't make me go, Derek. Please.
And what exactly happens?
Oh, it's not easy to tell. I mean, there's an operation going on, and there are surgeons and nurses.
And you're sure you're the patient?
Oh, yes. I'm the patient.
And is there anything in particular that makes it so frightening?
I don't know. I'm not sure. There's a voice I can hear.
Whose voice?
I don't know. A woman's.
Mary, what scares you is probably the fact that all this stuff is happening to you in your dream and you're aware of it. The knives and scissors and blood and what have you. Whereas, of course, in reality, when you're actually having the operation, you'll be out cold and not aware of what's going on. Reality, thank God, is much more pleasant.
Yes, all right. But it's not just that. I think somehow something goes wrong. I can feel this appalling pain.
Yes, that's a real pain. The appendicitis. You're feeling it in your cells.
But this is so much worse.
Well, you know dreams distort reality in every way conceivable. Silly fears get enlarged to absurd proportions. Listen, anything could happen to you in this dream of yours, but I tell you, if you don't get into hospital very soon, you're going to die. And that's for real. You're going to die. Do you understand?
Firm but gentle. I make a point, you know, regarding every piece of tissue and blood as if it were my own. There we are. Nurse, thank you. And very soon we'll have entry into the abdomen. There. Now to find the appendix.
Fasten your belt.
I'm feeling incredibly tired.
Here, let me help you.
Don't you believe that dreams can foretell the future?
No.
Well, you should. A year or more before we'd even met, I had a dream about our marriage, a recurring dream just like this one.
Less worrying, I hope. So when I proposed, you said to yourself, what the hell, let's make the dream come true.
You never did propose, remember? Not really.
Look, Mary, you'll feel no pain. You must believe me. You won't know anything about it. The anesthetic will knock you clean out. There'll be no pain. First thing you'll be aware of is coming to in the recovery room.
Oh, Derek.
The whole thing will be over. Mission accomplished.
Yes. What if I don't come to, though?
Oh, God.
But it could happen.
Oh, yes. And if it does, they slap your face and pour black coffee down your throat. All right?
Well, now, we've located the cecum. What next?
We look for the terminal part of the ilium.
Good. And that?
And in the lower angle of where these join?
There the appendix sits. So, scissors. You cut away one or two adhesions. Here. And here. And another. And very soon we'll be able to remove the little fellow.
I know what you did. You gave me an overdose, didn't you?
That's right. Wanted the pleasure of bumping you off before the surgeon had a
Derek.
chance. It was just to calm your nerves a bit. 3 pills the doctor recommended.
A liar, Derek Russell, a liar and a bastard.
Oh, well, if you don't like your marriage partner, you've only got your recurring dreams to blame. Actually, as it's transpired, I don't think you needed the pills anyway. Having that talk.
Oh, yes, yes. Get it off your chest. A trouble shared.
Well, for whatever reason. You don't feel quite so anxious now.
Yes, I do. Deep down inside somewhere, underneath all these bloody pills. As soon as I wake up again, Oh, my God.
What's the matter?
Wake up. Wake up. That's what the voice is saying in the dream. That's what...
Mary.
Oh, stop the car.
No. Why? What are you going on about?
Stop, please. I know why I'm having the dream. What it's telling me.
Mary, for the last time, you're having that dream because of what's happening inside you.
No.
The pain you're feeling is helping to trigger off.
No. It's a voice. Woman's voice. Wake up. Wake up, she says.
Mary.
God, it must be when the operation's over in the recovery room. And no, I'm not sure. It's all so confused. But she keeps on saying the words, repeating them in this desperate, awful way.
That's you, Mary. Trying to wake yourself up because you find the dream unpleasant.
No. Oh, God, take me back, Derek. Please, if I have this operation, I'll never wake up again. I'll be in some kind of a coma. That's what the dream...
Look, the bloody dream's not trying to tell you anything. You keep on having it because you've got appendicitis, and therefore you're thinking about hospitals, and you're frightened of hospitals, which is understandable in a way, but that's all there is to it.
Take me back home.
I can't do that.
Please. Oh, help me. Help me, please, help.
Shut up.
Oh, please.
Look, I'm sorry, Mary. I can't take you back.
Here it comes. The offending item. Still with us?
Yes, sir. Thank you, sir.
Next step is to wheel the needle and thread. True or false?
True, sir. False, sir. We clean up around the cavity.
correct. If you'd care to look, or even if you wouldn't, there's some pale yellow matter that needs clearing away. Not unlike custard. There. See? Boldness.
Is this it? Looks more like a prison.
Right. Here, I'll undo your belt.
Take me back.
There we are. Let's go, shall we?
I'm begging you, Derek.
No use.
Please.
No.
Do you remember our wedding day? Driving to the registry office in that wreck that kept on stalling.
Mary.
I thought we'd never get there.
Come on. Comfortable?
Yes.
Got everything you need?
No, I'm short of a disguise and a getaway car. Cheerio, then.
Yes. Cheerio.
See how brave I'm being?
Yes, darling. You look awfully tired.
Well, you'd be tired if you'd been drugged up to the eyeballs.
Lie back and get some sleep.
No, thank you.
You'll be all right, I promise.
Oh, of course. Good heavens, I'll be fine.
There'll be no pain. No pain. Minimal risk. I'm going to ring the sister at 5 o'clock.
Yes, you do that.
She'll tell me when I can come and see you. Just think, in a little while...
It'll be all over. Just like a bad dream.
Cheerio, then.
And now to close the wound. Do you don your own socks, student?
No, sir.
Start doing so. Well, wait till you get home. Get in some practice. Right, 2 kinds of needles, straight and curved. A curved needle is required initially here for the depths of the wound. Nurse? Thank you. As you see, I have a number of needles all in line, threaded and ready for action. But no thimble. Here goes.
Mrs. Russell? Mrs. Russell?
Hmm?
Good afternoon, Mrs. Russell.
Oh, hello.
I'm the anaesthetist.
Oh, yes.
I'll be the last person you'll see before your operation.
Yes.
I can tell you're a wee bit anxious.
Can you?
When we shook hands.
Oh, yes, of course, sweaty. Yes, clever of you.
What is it you're worried about?
Well, since you ask, I'm worried that I won't wake up after the operation.
You mean you won't wake up for a long time?
Or even won't wake up ever.
Oh, well.
Yes, I know I need have no fear on that score.
Absolutely none at all. I've got to give you sufficient anaesthetic, obviously, to keep you asleep for the duration of the operation, but no more than that. You'll wake up, I assure you. Have you ever been given a general anaesthetic before?
No.
Well, there's really nothing
to worry about. Yes, I know. Please, God, help me. Let me wake up when it's all over. Please, God. 10 green bottles hanging on the wall. 10 green...
Mary?
Only met her half an hour ago. We're on first name terms already.
Mary?
Nearly time, is it?
You got it in one. The porter's coming to take you to the operating theatre now.
Did you hear about Mr. Fazakerly?
Yeah, poor devil. When you work in hospital, you should expect decent treatment, shouldn't you, if you fall ill sudden?
Nurse, lie back, Mary dear.
Think of England.
Brave. 10 green bottles. 9 green bottles. This is my pain. This is my body. Take. Eat. Oh, yes, I'd be a believer if I could, but to be one now... Oh, Lord. There are the smacks of opportunism.
How are you doing, Mary? All right? Good girl.
Sudden lift.
Nurse? Nurse?
What is it, Mary?
I'm not all right, actually.
You'll be fine.
Highly experienced surgeon does it in his sleep.
Here we go.
3rd floor, linenware, lingerie.
Nurse?
Yes, Mary?
I'm frightened.
No, you're not. You're a brave girl.
I don't want to have this operation.
Nonsense.
We've not brought you this way for nothing.
I don't have to have it.
Of course you do, Mary.
What I mean is no one can compel me. You can't force me. If I want to, I can go back to the ward. I can get all my things.
Oh, no, you don't want to do that. You want to get yourself healthy again.
But if I want to...
No. When you go back to the ward, go. It's with your appendix in a jar. This is us.
Help. Help. Where are the reserves of courage, the inner strength, God damn it to hell, that people find when they absolutely need it? That they never thought they possessed. How much further?
Nearly there, darling. Left, right, and left again. Poor Mr. Fazakerly. I like the man.
Left. Right. And left again. We're there.
Hello again, Mrs. Russell. How are you feeling?
So-so.
She's feeling fine, aren't you, Mary?
Excellent. OK, what I'm going to do in a moment, Mary, is put a tiny little needle into you here. It really won't hurt. Just feel a bit cold, that's all.
Good girl now.
Hang on a moment.
You bastard, Derek, you bastard.
Right, now clench your fist and unclench it. Clench it again, very tight. Here we go. Steady. Steady. Oh, sorry. Mary, I'm going to have to try that again.
I've changed my mind. I want to go back
Don't
to the
be
ward.
silly now.
Be a good girl, Mary.
Try and relax. Now, clench your fist again. Clench it tight. Doesn't hurt. There. That's it.
Good girl.
No, bad girl. I refuse to have this operation. This is my body. They can't operate on me. I'm not going to sleep. I refuse.
Now, the next thing, Mary. I want you to breathe in some gas for me.
Good girl.
I refuse to have this operation.
Here we are.
Not going to sleep. Not going to sleep.
Breathe in, please. Good deep breath.
Not asleep. Not going to sleep.
And another one.
Mary.
You'll be right, Mary.
Mary.
Still awake, you see. Still awake. You see. You see. Fight it, Mary. This is your body.
Has she gone?
No. Still awake. Still awake. Still awake. Still awake. Not properly yet. Half awake, huh? Just like drowsing in bed on a Sunday morning. But I'm awake. And I've been asleep for... how long? I've no idea. And so... they must all be over. And when I open my eyes, not yet. Oh, what bliss. But when I open my eyes, there'll be a nurse there, not Derek yet. There'll be a nurse there with a smile and a cup of tea. Bliss. The operation's over. Successfully, I have to assume. Oh, thank God. Thank God. Mission accomplished. And I didn't really make too much of a fool of myself. I hope. And anyway, what was I expected to do? Who cares? Come and see me soon, Derek. You bastard. Oh, half awake. Not asleep. Not dreaming.
Labs. Splendid. Let's begin then.
Not asleep.
Are you the student?
Yes.
Well, come round here. You'll only see my backside from where you're standing.
Not asleep.
This operation is an appendicectomy. Look and learn.
Not asleep. Not asleep.
First thing, we want to ensure that after we finish, the wound joins up properly. How do we do this?
Blue dye, sir.
Correct. A mark here where I'm going to make the incision, and then across that mark here, here, and here. Tools of the trade. Scissors. Dissecting forceps. Tissue forceps. Knife.
Not asleep. Not awake. Can't move my eyes. Can't move my hand. But I can feel. I can feel. Wake up.
Scissors held thus.
Wake up. Wake up. Tell them.
For forceps, thumb and first finger.
Wake up.
Knife thus.
Jesus, help me.
Is that all clear?
Yes, sir.
Right, let us commence. The incision. Firm but gentle.
Allow me to reassure you that what happened to Mary is quite impossible. You have nothing to fear. I have every confidence in telling you this. After all, I was told by by someone who ought to know.
Dr. Howard, Dr. Fine, Dr. Howard. Report to operating room 7. Please report to operating room 7.
Oh, this place is like a maze.
Oh, there you are, Mr. Zorba Astronomicopoulos.
Who?
Amnesia. That's not good.
I'm not...
Let's just give you a thorough examination.
Go!
Okay, just have a seat right here.
There's somebody already here.
So there is, just a second. There you are. No more body. Just don't look behind the examination table.
What happened to him anyway?
Complications from a checkup, I'm afraid.
From a checkup?
Happens all the time. But don't worry, Mr. Astronomicopoulos. I found my note cards. Now hold still. I'm going to check your reflexes. First your knee.
Ow!
Looks good. Now your elbow.
Ow! Jeez, Pete.
Now your forehead.
Ow!
Now your Adam's apple.
Ow!
Okay. Now your big toe. Now your ankle.
Ow!
Now your collarbone.
Ow!
Now your forehead again.
Ow!
Now your funny bone.
Ow!
Now your...
Hey, wait!
Jeez, Pete! Please stop now! Well, everything seems to be in order. Now we can begin your surgery.
What?
Yep. Says right here in your chart. Needs transplants and stuff. And stuff is underlined. So that settles it.
I've got to get out of here. Say, doctor, look over there.
Over there? What am I looking at?
See ya.
Oh, Nurse Bosom, would you call security and find Mr. Zorba Astronomicopoulos?
Yes, Doctor.
I need him prepped for surgery and brought to operating room 6.
Yes, Doctor.
I'll be in there as soon as I figure out what I'm supposed to be looking at in the corner of the room. Let's see. Aha! No, that's not it. Oh, no, that's not it either.
I'd better get out of here quick.
Will this interfere with my ability to dress in my mother's clothes and kill lots of people?
How in the world did you end up covered in barnacles?
Well, I am covered in nutritious plankton as well, so it only makes sense.
And what's this thing?
Not quite sure, but it's been seeping for, I don't know, 35 years. And if I poke it, it screams. See?
Wow, is that man disgusting.
Mr. Astronomicopoulos.
Oh, man.
Mr. Astronomicopoulos. Mr. Astronomicopoulos.
Sorry. Sorry. Oh, sorry.
Mr. Astronomicopoulos.
Oh, that was close. Now where in the heck am I? It's somebody's office, and they have a phone. Let's see. Captain Boatmare's around here somewhere and doesn't have a phone. Dr. Von Martinez accidentally went on vacation. Dr. Despicable. Let me see. Come on, Doc. Come on, Doc.
I don't know how you got this number, but somehow you've reached Castle Despicable. I can't take your call right now because I'm a very, very busy man. Godlike, but a man nonetheless. At the tone, leave a message, and it better be good and important. I'm not made of reel-to-reel answering machine tape, you know. And if this is about insurance or my mortgage or insurance on my mortgage or socks or credit cards or anything else that has nothing to do with my taking over the world, be sure to leave your name, number, and address so I can have a crew of giant bloodthirsty killer robots on your doorstep ready to settle your hash. I will not be harried, hassled, harassed, dunned, distracted, beleaguered, besieged, badgered, pestered.
Oh, man. I really need his help right now. Well, maybe Nurse Bosom's gone, and I can get out of here. I think the coast is clear.
There you are.
Ow! What was in the hypodermic needle? What did you just give me?
It's a concentrated dose of abliptazine.
But I don't want a shot of... What's happening to me?
It's the abliptazine taking effect.
Really? That's great. Yeah, that's really stupendous. I'm happy. So happy.
Now, let's take you to operating room 6.
Cool beans, Steve McQueen.
In the dream, you are falling, lost in the listening distance, as dark locks in. Nightfall. Good evening. Tonight, I would advise you to make certain that all of your escape routes are clear. The play is called No Admittance, No Exit.
Sheila, on the bill here, you forgot the oil filter.
He didn't need one.
How many times do I have to tell you? You change the oil, you change the filter.
Barney, if that oil had been any cleaner, I could have taken it home to cook with.
That's not the point. The guy asked for full service, we give it to him.
Whether he needs it or not.
Look, He says he wants it. I say he needs it. You do it.
Whether it needs to be done or not.
Get out there. I got work to do.
Oh, me Lord and Master. He's a darling.
I never should have done it. Hiring a woman for a man's job. You're just begging for trouble.
Hi, Mr. Gordon. Got a loose fan belt, eh?
Is that what it is?
It's either loose or worn out. I'll check. Would you be needing gas?
No, Sheila, just fix that noise. It's driving me crazy.
Well then, shut off the engine and open the hood.
Hey, Barney.
How's it, Gordon? What's up?
Ever since you serviced the car last week, the engine's had a funny noise.
What kind of noise?
Chirping noise, you know, like a gerbil.
You mean like a chipmunk?
Yeah.
Huh. Sounds like the water pump. Start up the motor. Oh, you stupid bitch!
My God, what's she...
Turn it off!
Sorry, Barney.
God. Her hand.
Let me see it.
Get her in the car.
No.
Get a cloth, towels, anything. We've got to stop the bleeding.
Oh, right.
Hang on. We'll get you to the hospital. That's it. Now, lean on me. All right, just ease yourself in. Bring your hand back. There.
Joe.
Yeah. I got him.
Now press it on the wound. Not like that. Firmly. Get in. I'll drive. Close the hood.
I can't leave.
You have to. I can't look after her and drive too. Get in and close the door.
I don't know what you expect me to do.
Keep the pressure on.
The towel's already soaked.
If anything happens to her...
Oh, she's all right. You all right, Sheila, honey?
Cold.
Put your arm around her body.
Huh? Oh, sure.
Where's the nearest hospital?
There's a new one. It's just open and close. But they wouldn't take us. I think it's special.
They'll take us. They'll have to. Where is it? What's it called?
Well, they call it the Future Clinic. Blood all over the place.
Where are we going?
We'll be there in a minute.
How much blood does a person have?
Enough.
Well, how much can you lose before you need more? They're bad luck, you know, women. Who ever heard of a woman mechanic? She talked me into it. Should have known. Fishermen won't even go out in the water with them.
Hang on, girl. This it?
Hey? Oh, yeah. She made me think she could do it.
Okay. You ready to get her out?
She looks awful white. Hey, the place is empty. Where is everybody?
Find a stretcher. Find an orderly.
Where are we?
Attention, please. Welcome to Future Clinic. Place patient in wheelchair, please.
What? Where are you?
Where's the wheelchair?
Observe, please. Enter the elevator and utilize the indicated wheelchair. An attendant will meet you at the appropriate lower level.
Emergency! We need emergency!
Enter the elevator, please.
Come on,
please.
Professor. Professor, you heard her.
Very well. Sheila, just a few more steps and everything's going to be all right. Okay. Now, I'm going to sit you down.
Yeah.
There.
Hey, Professor, there's no buttons on this elevator.
My God, you're right.
They seem to know where we're going.
I'm glad somebody does.
Oh! My hand. I can see the bone.
Keep it covered, Sheila. We'll be there in a moment.
Where's there?
Oh, now, don't worry, honey. This is the future clinic. They know what they're doing.
Here we are. What's the matter with the doors?
Hey. Open the door. Oh, somebody answer.
Are we there?
Attention, please. Enter the corridor now.
Barney, take it easy.
I just want out of here. Hey. This is like a prison tunnel.
Keep moving. There's a door at the far end.
Harvey, get me a drink.
Yeah, just a minute, honey. We're almost there. Listen. Where are the doctors and the nurses?
Where's the damned orderly she promised us?
Attention, please. Is the patient male or female?
She's a woman.
Attention, please. Is this an illness, a pregnancy, or an injury?
An injury? A very serious injury. She's lost a good deal of...
Attention, please. We require one of the following. Social insurance number, hospital insurance number, Visa card.
Oh, it's back in the station.
We don't have the numbers.
Professor, the door. It's locked.
Open this door, now.
Look what it says. No admittance.
Attention, please.
My name is Sheila Lana Sullivan. My address is 100 Durham. Phone is 967.
For God's sake, this woman is badly hurt.
Attention, repeat phone digits.
You idiot! This girl is bleeding to death.
Attention.
My name is Sheila.
Her phone number is 967-5254.
Requirement satisfied. Enter. Attention, please. Proper procedures require full cooperation.
Oh, give us further instructions. But please hurry.
Attention. Proceed to Medi-Center directly ahead.
This is spooky. Jeez. Looks like a spaceship in there.
Voice transmission should contain pertinent medical information only.
Oh, the whole place is bugged.
Attention. Continue moving. Do not transmit irrelevant information.
For the love of God, stop that voice. Stop.
I'll take Sheila. Get the door. If it opens.
It does. Go ahead.
Well, surprise, surprise. A human being, I believe.
Hello, I'm David Bruff, your comfort coordinator.
Where's the doctor?
Would you gentlemen step behind the protective shield here, please?
Oh, yes, sir. Yes, sir. Here?
I am not moving until a doctor gets here.
Of course, I appreciate your concern, but you can see and hear everything from behind the glass.
He's right, Professor Borden.
I'm staying here.
That's fine, Dr. Borden. If you wish to remain in the direct force of the computer scan, that's up to you. The genetic damage should be very minor. Now, we'll just get on with the diagnostic process.
Diagnostic? Are you blind? There's a trail of blood down the corridor.
Excuse me, I have to move her to the left. Ms. Sullivan, can you hear me? Miss Sullivan, my name is David.
Her name's Sheila.
Don't be frightened. We're just lifting you onto the examination table.
Gee, that thing has a smooth action.
What the hell are you doing?
Where am I? Heat. Bright sun. Lighting.
You're right here with me in the hospital. We're just moving you under this light.
Attention, please. Patient is not centered. Please adjust.
What's going on here? This girl needs treatment.
Yes, she does, Professor, and she will see the best. By the way, your face is very red. Are you sure you're all right?
The heat is getting so hot.
I did warn you, Professor, but you wouldn't get behind the shield.
What about Sheila? What's it doing to her?
Shh, quiet. The assessment.
Sheila Alana Sullivan, Caucasian, female, country of origin, Republic of Ireland. Age, 25. General health, excellent. Single mother, apprentice mechanic, education incomplete, earning potential insignificant, assimilation to North American society unsatisfactory. Feminist opinions and pursuit of male work role are neurotic overcompensation. Standard immigrant insecurity. Environmental adaptation, poor. Societal impact, minimal.
Mother of God. Pity on a country where they teach the very machines to hate.
This is monstrous. Where are the doctors?
The assessment will be complete in a minute, and then the doctors are allowed to proceed with the appropriate treatment.
Come on, over here, Professor. You'll get a better view.
Please, for your sake, Professor.
Oh, for hers. I'm no good this way.
Attention, please. Patient assessment. Sheila Alana Sullivan. Multiple lacerations of left hand. Main sensory nerves severed. Retracted thumb tendon. Extreme muscle and ligament damage. Major destruction to skeletal structure of hand. Massive blood loss. Treatment procedure options. First, maintenance treatment. Amputation of left hand. Prosthesis installation. Industrial training. Time duration, 3 months. Second, restoration treatment, rehabilitative surgery, continuing cosmetic adjustments, intensive physiotherapy, time duration, 2 years. Recommendation procedure number 1, maintenance treatment.
Now what happens?
Now we proceed.
Hold on. You're not amputating her hand. You got it, Professor.
Operating room 6 in readiness. 6 units of Rh negative blood available. Surgical team standing by. Post-operative care alerted.
Don't hurt me. Please. Don't hurt me.
It's okay, Sheila. I'm going to give you this injection. It'll make you feel like you're floating. Think of something lovely, like flowers. Can you smell flowers?
Neil likes tulips best.
And Neil's your friend.
My son. Neil's my son.
You see, gentlemen, perfect dreamland. There'll be no pain at all.
You can stop right now. I'm not letting you do it.
And down. Come. And off to surgery.
No. What do you...
Shh. You'll wake her up.
That's fine, Professor Borden. Now, I have to fill out my admitting report. You can help me. And aren't you feeling better since the scan stopped?
What's that?
Elevator to the operating room, of course. You said yourself it was an urgent case.
Activate deliverance of patient for surgery. Staff waiting.
Excuse me, Professor. I have to send her down now.
This is some kind of lunacy. You have no right to proceed in this fashion.
In we go.
You are deliberately mutilating this woman. She won't be able to work. Her child will suffer. You're destroying her life. Professor, these people know what they're doing. They're experts.
If you upset yourself, you may become ill again. She'll be given adjustment therapy.
I don't believe this is a hospital. Where are the doctors?
It is. And this is a patient. As for the doctor, you've seen, or rather heard her.
This woman. She isn't real to you. She's an object, like this wheelchair. Money, recovery time, societal impact.
You heard the assessment. There's nothing particularly useful about her.
I think you better move, Professor.
I'm not budging from this door.
Delivery of patient in 3 minutes. Surgical team will disband.
Sir, I don't know your name.
Barney. Barney Novak, sir.
Mr. Novak, I'm going to have to call on you to assist me.
Yes, sir. Professor Borden, I'm sorry, but you have to move out of the way.
Stay out of this, Barney. You've already done enough damage. You caused all this.
No, it wasn't me sitting in that big, expensive car. It wasn't me that turned the key.
Pull him away.
I got him.
Take care of Sheila.
That's it. Get him over there.
I can't breathe. The pain.
Goodbye, Sheila.
Let me go. No, not yet.
It's all right, Mr. Novak. She's gone. Let him go.
Just crushing. Ribs going to snap.
Jesus, face. He's purple.
Loosen his clothing and we'll get him up on the examination table.
What's wrong with him? Professor Borden, I didn't mean to hurt him.
You did what had to be done, Mr. Novak. Professor Borden may have just fainted from the strain, but I don't like those symptoms. We'll just run him through the diagnostic process, shall we?
Oh. Yes, sir. What do I do?
What does the computer need to help Professor Borden? Think now.
His SIN number.
Good man. You'd better get his wallet.
Is he going to be okay?
He's going to get the most advanced treatment in the country. A social insurance number, please.
Here. 401-624-102.
Alan Borden, Caucasian male. Country of origin, Canada. Ethnic descent, Anglo-Saxon. Age, 56. Marital status, widower. Professor of Canadian History, University of Toronto. Earning potential, stable middle income bracket. Health, low-grade emphysema, mild diabetes, enlarged liver, high cholesterol count, societal impact, limited.
Diagnosis next. We'll know in a minute, won't we?
In just a jiff.
Ruptured aorta, blocked pulmonary artery, imploded heart cavity. Treatment procedure options. First, open heart surgery, aortal bypass, reconstruction of damaged muscle, 3 months monitoring in intensive care, followed by further surgery for placement of heart pacer. Hospital bed care, time duration, 1 year. Second option, relieve discomfort with injection of 30 cc's of morphine.
No!
And the recommended procedure?
Option 2, injection.
They're trying to kill me. Barney, for God's sake, get me out of here.
You're a sick man, Professor Borden. This is the best place for you.
Don't touch me.
Just rolling up your sleeve, Professor. In a minute, you'll feel like you're floating. There. Now you'll sleep.
Place patient on stretcher in elevator. Activate delivery. Quiet room is in readiness.
Is he sleeping?
Yes. Stand clear of the doors.
What'll happen now?
The indicated procedure is activated.
Yeah. It's amazing when you think about it. The computer can do everything.
That's right.
Hey, it couldn't give me some advice, do you think?
Well, a little health problem, Mr. Novak?
Oh, I get, a stomachache now and then.
Have you seen a doctor?
I've been so busy.
Climb up on the examination table. We'll find out in a minute if it's anything to worry about.
I should get going.
Nonsense. You're here now. Give me your social insurance number and we'll start.
Well, it's 102-620-861.
Louder, please. It must hear you.
102-620-861. Hey, this won't hurt, will it?
Of course not.
Barney Stanislaus Novak. Caucasian male. Country of origin, Canada. Ethnic descent, Polish. Age, 48. Marital status, unmarried. Education, incomplete but superb mechanical facility. Superb mechanical facility.
She's acting funny. What's happened?
That's the comparison key.
What?
Assessment has been suspended. You're being compared with other individuals in the memory bank.
Oh. Holy jeez.
Attention, please. Comparison of available data indicates mechanical facility of 102-620-861 Novak Barney S. as superior to that of 103-725-944 Roth David K.
No, please.
Attitude of mechanic Novak has been examined and found highly positive. Novak, respond, please.
Wait. You mean, do I want to work for you? Here?
Idiom, imprecise, general content, correct?
Oh. Yeah. I'd love to be a part of something like this.
Please.
Service failures of former attendant Bruff have been traced to physical malfunction as well as to inferior capacity. Bruff, David K., please position yourself on the scan table for diagnosis, assessment, and treatment options.
For God's sakes, no. Mr. Novak, help me.
Patient Bruff, just call me Barney.
Oh, where am I?
You're in operating room 6. The doctor's about to remove all your internal organs and replace them with things he found in his garage.
That doesn't sound like a great idea to me.
Well, it is. And I'll go get you more upliftazine, so you'll think it's a good idea, too. Be back in a sec.
Sorry I wasn't able to introduce the last bit of OTR. That was Nightfall, no admittance, no exit. And the song that followed was Thurl Ravenscroft, Teenage Brain Surgeon. I need to get it together. Must get out of these restraints and get out of here. Oh no, not Nurse Bosom already.
No, it's not the nurse.
You're not the nurse. Sorry, you just said that, didn't you? You're not the doctor either. Hey, wait! I recognize you!
Is it because I'm wearing my mother's clothes?
You're that crazy guy!
I'm not crazy. You're the one that's crazy. You're driving me crazy.
Oh man, we've got to get out of these.
I just wanted a Pepsi.
Come on!
I think I'll try this bone saw out on you.
Wait!
Yes?
Do you have a cell phone I could borrow for a second?
Oh, sure. Here you are. It is a local call, right?
But yes, of course.
Oh, that's fine then. My calling plan doesn't include free unlimited long distance. I really must kill the phone company for that.
Oh, here you are.
May I continue?
Sure, I guess. Whatever.
Mother always wanted a doctor in the family.
Hey, he got one of the restraints. Got a free arm.
Hold still a second.
Maybe if I can move with him, get him cut the other restraint. Well, I guess cutting my hand off frees me as well.
I'll swallow your soul. I'll swallow
where you are. There's so much left of you to cut to pieces.
Gotta think of something fast. Hey, your dress is unbuttoned.
What?
I can see your bra.
I must cover up. Oh, my organs! They all fell out! This is so gross! Oh, I can't get them back in! Oh, somebody help me! I think I need some scotch tape or something.
Can't believe he fell for that. Wow, I've never seen anyone accidentally saw through their own ribcage before with a bone saw.
And that's what the lungs are for.
Yes, Doctor.
Oh, it's a nurse and the doctor.
Sounds insane.
I can flee out the other door.
Now, Mr. Astronomicopoulos, it's time for... Oh, goodness. Nurse Bosom, help me get him back on the table, please. There we are. Oh, look, he started without us. Less work for me.
Dr. Howard, Dr. Fine, Dr. Howard, report to the morgue, please. Please report to the morgue.
Here's our last mad medical tale. A classic story that shows that even private practice can get crazy. Here's Ray Bradbury's Skeleton.
Our next story, Skeleton, is an example of the way I react to some real encounters with real people. I went to my doctor one day when I was 22 years old, and I had a sore throat. And I said, it sure feels funny in there. The doctor took his flashlight and probed around and looked at my throat, and he says, oh, there's nothing wrong. Take 2 aspirins, go home, and forget it. And it looks a little red, but you're okay. I said, yeah, but feel my neck here, a little gristle, a little fat, a little muscle, whatever. I've never felt anything like that. He says, you haven't paid attention to your own body. You've got all sorts of peculiar things in your body you've never even noticed, like the medulla oblongata on the back of your skull, the original fissures from the top of your head when you were born. The skull is in fragmented in many ways and grows together over a period of weeks. You have floating ribs. You have your elbows. You have kneecaps. You've never really felt your skeleton. You go home and feel it, huh? So I left my doctor. I went out the street feeling my elbows and my medulla oblongata. And I said, my God, I never thought of it before. I have this gothic thing inside me, this strange intruder, a skeleton, huh? Once that hit me, 3 hours later, the short story was written. And I had a heck of a lot of fun with it. And I hope you will enjoy it as much as I did when I wrote it. So here it is, Skeleton.
Harris, come in. What can I do for you this time, huh? Oh, sit down, man.
Well, it's the same thing, Doctor. Aches and pains, you know.
Where are they, these aches and pains?
Everywhere, really. They seem to be right in my bones.
In your bones, huh? Right. My dear Harris, you've been curried with the finest tooth combs and bacteria brushes known to science.
I know that.
You're just nervous. Let me see your fingers. Too many cigarettes. And your eyes? Not enough sleep. Go to bed earlier, stop smoking, and that'll be $30, please.
Well, thanks for nothing, Doctor.
What more do you want, man? You're a hypochondriac. That's $50 now.
Oh. But why should my bones ache so?
Have you ever had a sore muscle and kept fussing away at it, rubbing it? It gets worse, doesn't it? Then you leave it alone, and the pain vanishes. Leave yourself alone. Take that trip to Phoenix you've been planning. It would do you good to travel. Now get out of here and send in someone who's really sick.
Black coffee?
Thanks. Say, you got a phone directory?
Sure. Over there, help yourself.
Bone specialist. Bone specialists.
Can I get you anything else?
No thanks. Just a guy who knows what he's talking about. That's what I need. Wait a minute. Munigant. M. Munigant. 3 blocks down, 1 block over. My phone first. No. I'll go straight over there.
Mr. Harris? Is that what you said your name was?
Yes.
How can I help you? What, brings you to me?
My damn fool doctor. He hasn't any idea what's wrong with me.
But you feel that there is something wrong. With your bones, presumably.
I don't see what else it can be. I have the most terrible aches and pains all the time. I feel it must be my skeleton. It protests. Does that make sense? There's something wrong somewhere.
Oh, I'm sure there is. I've seen cases like yours before.
You have?
Indeed. Man is usually unaware of his bones, but occasionally there occurs an imbalance. An unsympathetic coordination between soul, flesh, and skeleton. And that's where I step in. Do you take my meaning?
I think so.
May I show you a few x-rays? Just as an example, the skeleton. Perhaps you haven't considered your skeleton before. Look. The long, the short, the large, the small bones, the cranium, the spinal cord, the pelvis. All this is deep inside you, clothed in flesh, to be sure, but it can become troublesome sometimes.
Troublesome?
It sounds very much as if your skeleton has become a trouble to you.
It certainly is. But can you do anything about it?
Do you wish your bones to be treated?
That all depends.
On what?
On what's involved. And there's the cost, too.
Oh, I wouldn't worry about the financial aspects. We can come to some arrangement. But I can't help you unless you are in the proper mood. For the treatment to work, the patient has to want help very badly. Otherwise, there's little I can do.
Would it take long?
That also depends on your cooperation.
Well,
shall I try?
Okay, why not?
If you just come over here and lie down.
Here?
Yes. That's perfect. Just perfect. Open wide. You'll just feel a little pressure on your jawbones. Here. Wider. Now, a little wider. You almost bit my nose off. No use. Absolutely no use, my dear sir. Now is definitely not the time.
You sound disappointed.
Oh, but I am, my dear sir. On your account, of course.
So, what can I do?
I would advise you to go away and think about it. When you feel you can cooperate with me, then maybe something can be done.
Okay, what do I owe you?
$10 should cover it this time, my dear sir. I did very little. And meanwhile, here is a sketch for you to take home with you.
It's very detailed, isn't it?
Oh, very. It will serve to acquaint you with your body. You must become more aware of yourself. You must be on guard. A skeleton is a strange, unwieldy thing to have inside you.
I never thought of it that way before.
Oh, but you should, my dear sir. Now, good day to you. Would you care for a breadstick?
A breadstick?
Why, yes. I find I chew them all day long. Delicious. So nice and hard and salty. And crunchy. I find it keeps me, in practice. Don't you know? Have one. Do.
Well, thanks.
Now, good day to you. Good day, Mr. Harris. And I do hope to see you again in due course.
Well, yeah. Maybe so. Maybe so.
Are you still brooding, my sweet? I wish you wouldn't.
I can't help it. It hurts.
What hurts?
Every bone in my body.
Oh, my dear.
Clarice, your kneecap. Is it supposed to do that?
Supposed to do what?
Is it supposed to run around on top of your knee that way?
So it does. I never noticed.
I'm glad you're slithers, too. I was beginning to worry.
About what?
My ribs don't go all the way down either. They stop here, and I found some confounded ones that dangle in midair.
Of course they do, silly. And those funny short ones are just floating ribs.
I hope they don't float around too much. Thanks for worrying about me.
Oh, any time, my darling.
Did you realize the nose bone grows down only this far? From there on, a lot of gristly tissue fills out the rest.
Of course it does, darling. Don't be so silly. Look, I'm going back down to my bridge game. The girls are waiting for me.
Off you go. God almighty. Why did I never realize it? All those years I've been walking around with a skeleton inside me. A skeleton. Gouge-eyed, skull-faced, shake-fingered. One of those rattling things that sway from neck chains in abandoned web closets. Or found in the desert all along and scattered like dice. God! And it's inside me.
Darling, why don't you come down and meet the lady?
Sure, I'll be with you in a moment. When I stand up, it's a skeleton that supports me. With every step I take, I realize just how dependent I am upon this alien thing inside me.
Darling!
I'm coming! Oh, brace up, can't you? I'll take that trip to Phoenix. I'll go Friday. A new business, a whole new career. Maybe Doc Burley's right after all. It'll take my mind off things. Yes. I'm coming, darling. I'm coming.
My dear, what is wrong with you? Why did you go rushing off like that?
Have they all gone?
Oh, sure they have, but...
I threw up.
Oh, I thought you had.
It was their teeth all smiling at me.
Well, of course they were smiling at you.
Don't you see? It's part of their skeleton showing through.
What are you doing now?
Cutting my fingernails. That's my skeleton, too.
Oh, my darling. Fingernails are not bone.
Are you sure?
Sure, I'm sure. If you aren't the darndest hypochondriac...
I'm okay. I've decided. I'm going to Phoenix Friday.
To see Mr. Crelton? Do you think he'll lend us the money?
I think he will. Then we can build a kiln and set up shop for ourselves.
Oh, you certainly have plenty of talent, darling. Harris Ceramics, I can see it now.
Oh, Clarice, if only I weren't so...
Oh, come on. What's wrong? Tell Mama.
Nothing. It's just something inside me. Maybe it's something I ate. A skeleton. Except that it isn't mine, is it? It's a law unto itself. It's a slick, clean structure of efficient organization. Where's the mirror? Just sometimes I can see the skull grinning at me from behind my flesh. Let go of me, stop squeezing me, my head aches with you.
Observe the flawless, snow-white perfection of the skull.
Let my insides be, stay away from my heart.
Then observe the tiny bones of the skull's nose before that monstrous nasal cartilage begins.
Look at my body, so plump, so...
Consider the skeleton, slender, svelte, economical of line and contour, like exquisitely carved oriental ivory.
And my eyes, protuberant, ordinary.
Be so kind as to note the eye sockets of the skull, so deep and rounded, somber, quiet pools, all-knowing, eternal. Compare the skeleton.
Compare. Wait a minute. If you've got me, I've got you. I can make you do anything I want, and you can't prevent it. It's a 50-50 fight. Even Steven. And we'll fight it out, we two. Even if I didn't have you, I could still think. No, let me go. Let me be. Leave my brain alone. I'll have the chicken, please. Cream potatoes, and yes, cauliflower with cheese sauce.
Hi, Harris. Say, have you lost weight?
Yeah, a couple of pounds, maybe. Think you can starve me, make me lose weight, peel the flesh off. Leave nothing but skin on the bone. Oh, and a dessert, please. That one there with all the cream.
Don't know how, eating the way you do. Are you really going to eat all that?
I sure am.
Well, you won't suffer from calcium deficiency anyway.
How do you mean?
All that cheese and cream and milk. Good bone food, that, even if it is bad for your heart.
God, is that what you're doing? Well, I'll eat for one of us, my lad, but not for both.
Harris, what's wrong, man? Your lunch. You've left your lunch behind.
150 pounds. Do you see how I've changed?
For the better. You were always a little plump for your height, darling. I like your face. It's so much nicer. The line of it is so firm and strong now.
They're not my lines. They're his, damn him. You mean to say you like him better than you like me?
Him who? Who are you talking about? And what are you eating?
Malt tablets.
But, darling, you really don't have to regain the weight for me.
You don't understand.
No, I don't understand. Come on, lie down. Put your head on my lap. That's better. You know, I've watched you lately. I'm so worried about you. You look so hunted. Maybe you should see a psychiatrist.
I've seen a bone specialist.
Then surely he told you. You and your skeleton are one and the same. One nation, indivisible. United you stand, divided you fall. You're in a vicious circle. The more you worry, the more your bones stick out. And then the more you worry. After all, who picked this fight?
I guess I did.
Well then, you rest now. Rest and forget.
Perhaps I should go back to M. Munigant, the bone specialist, you know.
Perhaps you should.
M. Munigant.
Darling, what's wrong?
M. Munigant.
Pain. Oh, Clarice. I'm here, darling. I'm holding you. Oh, God, darling. Forget this bone specialist. He hasn't done you much good, has he?
No, he hasn't.
There. Is that better?
I guess it is. He ate breadsticks.
What?
He told me he ate breadsticks all day long.
How bizarre. Is that better?
Yes, much.
You just go to sleep now. Sleep.
Same again.
Here, you look kind of down, my friend. Let me buy you this one.
Thanks. Say, how do you do it?
Do what?
Keep in shape like that. Not a bone to be seen. How do you do it? That's what I'd like to know. How do you stay so fat?
Are you having me on?
No, I mean it. I envy you. Your health. Is there a special diet? I can't seem to put on any weight, whatever I do. I like a stomach same as yours. Just how do you do it?
You are drunk, my friend, but I like drunkards. I'll tell you. I built this body layer by layer over 20 years.
How do you do it?
You get yourself a quarreling bird of a wife and a baker's dozen of troublesome relatives. To these, a sprinkling of business associates whose prime motivation is snatching your last dollar. And you are well on your way to getting fat.
Why?
Well, because in no time at all, you'll find yourself building a fine layer of fat between yourself and them. Eating is the only fun on earth. Too many people in this world haven't enough to worry about, so they begin picking on themselves and then they lose weight. That's the long and short of it, my friend. So, drink up, laugh, and grow fat.
That's more or less what my doctor said.
And believe me, he's right.
Maybe I'd better take that business trip to Phoenix after all.
Maybe you better. Take your mind off things. Well, I'm off. Got to go home to dinner. Good luck, my friend. Good luck to you.
Good to get away. They're all right. The doctor, Clarice, even the fat man in the bar. I need to stop thinking about myself all the time. Get some outside worries. Forget all about that damn M. Munnigan and his... Oh. So thirsty. So hot. That bush. Over there. I can just... So that's it, is it? One way or another, he'll starve me, thirst me, kill me. If the sun cooked my flesh so you could peek out, if the vultures lunch off me, there you lie, grinning with victory. You'd like that, wouldn't you? Freedom. Your freedom.
Hey, you! Are you okay, pal?
Oh, thank God. Oh, thank God you found me.
Thank God you're all right. Oh, darling, I was so worried about you.
Were you?
Oh, let me kiss you. Darling?
I'm okay.
And the business deal?
I guess it went through.
Oh, but that's wonderful. Just wonderful. Oh, but you look thinner. I guess it was a night in the desert.
Yeah, I guess that was it.
Dinner's waiting.
Good. Good.
Darling, would you mind very much if I went out for a while tonight?
No. Why should I? I'm just fine.
Only it's my Red Cross night, and...
Oh, yes. I forgot.
Darling... You seem so... I don't know. Are you sure you'll be okay? Just for an hour or two.
You go out. I'll be fine. Come on, let's eat, and then you can be off. I need some time to myself. At last. Come on, come on. Yes. M. Munnigan?
Mr. Harris, how can I help you?
I have to see you. Can you come round? Can you come here? Right now.
Mr. Harris.
Come in. Come in, for God's sake.
My dear sir, You look just terrible. A walk-in skeleton.
Don't! The pain! I can't bear the pain!
Ah, we're at that stage, are we? And now, you are ready for me. Isn't that so?
Yes, I'm ready. It nearly got me, I crashed the car in the desert. It nearly had me. If they hadn't found me...
Indeed. I was right. This skeleton of yours is a traitor, it seems.
Oh, the pain! The pain!
Shall we fix him once and for all?
Please. Oh, please. Can you do anything?
Of course I can.
But you seem to be growing smaller.
I? Smaller? I don't think so, my dear sir. Are you perhaps delirious? Lie back now. Lie back in this chair. Relax. There now.
Monaghan, I never noticed before your tongue. It's round, tube-like, hollow.
Delirious?
Yes, that's it. Delirious.
Relax and open your mouth. That's all. I'll do the rest. Now, let me see. Wider, please. Wider still.
Your voice? What's happening to your voice?
Wider and wider, please. Wider still. Relax, Mr. Harris. Now.
I can't breathe. What are you doing? Where are you, Monaghan? Monaghan, in God's name, where are you? Where have you gone? Help me!
Where do you think I am, my dear sir? I'm in here, disposing of that tiresome skeleton of yours. Breadsticks. Just like breadsticks. And very delicious they are, too. Ah, dear lady.
Who are you?
M. Monaghan's name. Bone specialist.
What is that you're eating?
What does it look like, my dear lady? A breadstick. Delicious. So crunchy. Such a goodie. Take care now. Mind where you put your feet.
Darling! Darling, you didn't tell me. Darling, where are you? What is that on the carpet? Darling, where are you? Why, it looks like a huge jellyfish.
Is that you? Darling?
Delicious. Long and crunchy and salty. Delicious, my dear lady. Delicious. But mind where you put your feet.
And if this is about insurance or my mortgage or insurance on my mortgage...
Doggone answering machine! Maybe I can still find an exit. An elevator. Maybe I can find a way out on another floor. This is strange. Just a long hallway leading to a huge door. I wonder what's behind that door.
Hello, zombie.
Doc, what are you doing here? Are you trapped here too?
Trapped? Why, no, dear boy, I'm not trapped in this hospital. I own it.
What?
Well, what better way for me is there to experiment on an obscenely large number of people than to operate a hospital?
You've got to be kidding me.
Well, it helps fund my experiments and other side projects, and is a handy source of fresh spare parts. Here.
Upliftazine? I don't understand.
Read the label.
Manufactured by Despicable Industries.
Welcome, zombie astronaut, to Despicable Hospital.
And now it's time for another episode of Despicable Hospital, starring Dr. Despicable.
Dr. Despicable?
Ah, Nurse Bosom.
I've been trying to talk to you all day. I have to tell you something.
My apologies, my dear. I've been busy with patients all day. Another satisfied customer.
Doctor.
Please, my child, use my first name.
What is your first name?
Doctor.
Doctor,
That's 3 in Rome.
I am madly in love with you, Doctor.
You must be joking.
It's no joke. Knock, knock.
Who's there?
Me.
Me who?
Me, who loves you very much.
That wasn't very funny.
I told you it wasn't a joke.
Ah, so you did. Nurse Bosom, I am already in love with another.
Say it isn't so.
I am in love with science. Yes, science is my mistress, and I do perverted things to science when we're behind closed doors. Science is the only thing I can ever love. And pie. Oh, and hard narcotics.
You'll regret spurning me for science. Besides, I'll tell you a little something you don't know.
Doubtful, but proceed.
Hello, Nurse Bosom. Dr. Despicable.
He's been messing around with science behind your back.
What?
Oh, dear. Tune in tomorrow for another episode of Despicable Hospital. Despicable Hospital has been brought to you by Upliftazine. Upliftazine. Come on, everyone else is taking it.
This has been the Zombie Astronaut's Frequency of Fear. For more horror, sci-fi, and suspense audio, see the website at www.zombieastronaut.net. Right now!
Is There a Doctor in the House was written by Brent Hinks, K.C. Locke, and W. Ralph Walters. Ellie Hirschman was Sergeant Staccato. K.C. Locke was the man in therapy. Taylor Kent was NASA Official Number 2 and Doctor Number 2. Terry Shavas was Paramedic Number 2 and Nurse Bosom. The patients in the waiting room were Taylor Kent and W. Ralph Walters. Brent Hinks was the psycho in his mother's clothes. Dr. Despicable appeared courtesy of Upliftazine and Despicable Industries. All other voices were by W. Ralph Walters. The theme song was written and performed by Papa Suede. All other music was licensed by Big Fish Audio, Loop Masters, Network Music, and Pro Samples. For more Frequency of Fear, visit frequencyoffear.com. For more Frequency Light, visit www.zombieastronaut.net/frequencylight.html.